Hi, my name is Dr. Fred Sylvester from Hanover Chiropractic, and welcome to this edition of Health Talk. Today we're going to kind of explore some of the advantages that our clinic has to offer, and one of the things that we just added most recently was laser technology. Laser technology is a fascinating tool in the defense and we'll say against any type of anti-inflammation, pain, swelling. It has a tremendous amount of healing potential that allows us to use this technology to help patients actually heal a little bit more quickly and a little bit more efficiently. So to explain laser, I think it's important to kind of step back in time and start to think about how it all started. Back in 1913, 1914, famous scientist Albert Einstein is the first one who actually coined laser. And back 100 years ago, he named it biophotomodulation. Big word for laser. And what this is laser has an effect, light has an effect on cells. And it's a very positive effect that we're able to start to utilize in today's world of healthcare. 1970, a Dr. Messner out of Germany started using it more in the clinical application. And then by the year 2000, FDA started to approve it, looking at the efficacy and safety of how laser should be instituted and how it can be used in the patient treatment plans. 2010 through 2016, a very strong point of evidence started to come forth where third-party research started getting involved with laser and just started seeing, does this laser really have an effect? Does it actually work? And so many studies, 3,000 plus, have been illustrated and peer-reviewed since about 2015, all showing the positive effects of what laser can do. So when you start thinking of the history, even though it's a new technology that a lot of clinicians are starting to use, physical therapists, chiropractors, it has been around quite a long time and has quite an extensive history. When you start to think about what laser is, it's really about scattered light being condensed into a beam, and as that beam comes into a streamed focus at this point, whatever it touches within the body has the potential to heal and recover and regenerate. These are very important components to understand about how healing and how healing occurs for us. When we start to think about in inflammatory response, it's important to kind of have a couple understandings of what inflammation is, because inflammation is one of these terms that are thrown around all over the place, and a lot of people just don't understand what inflammation is. Inflammation has 5 physical effects. It's going to have redness, it's going to have swelling, it's going to have heat, it's going to have pain, and it's going to have a loss of function. Any one of those or all those are going to be what inflammation is all about. Now, inflammation is a very interesting component because it's the natural body's response to either an injury or an infection. And what's supposed to happen is the inflammatory process is supposed to start to kind of have a natural process. And then what's supposed to happen is it's supposed to go from injury to repair to regeneration. But some injuries are a little bit stubborn, as evidenced by how many people we see in our clinic over the course of a year and a day and everything else. You'll start to see that pain patterns and inflammation will stick around well beyond the 2 weeks that would be considered normal for a tissue to heal and regenerate. So what makes us stick in this cycle of going from injury to repair and not getting to regeneration? Well, what happens is that normal life can show up, and we can have an injury that we initially had, and then we start to get the chemical inflammatory process. That takes you to repair, but then you have another injury, and that injury continues to cycle back and forth. So in that cycling, that's what creates that sluggishness or that getting stuck in a pain pattern. So again, the concept is that inflammation of the body is a very natural phenomenon and process, and it's designed to, once you get to regeneration, to stop. And when inflammation stops, then ultimately what happens, so does your pain. And that's where we want to start to think about. So there's a couple techniques and that type of stuff that allow us to accelerate the healing mechanism of many, many different injuries, okay? But in order to understand how laser works and how the technology is going to be affected, is that what it does is that it's all about wavelengths. And wavelengths are a fascinating component because the visible spectrum, everything we can see, has a range of between 300 nanometers wavelength and up to 700. And the further you go beyond 700, then you start to move into the invisible spectrum. And the further you move on to the other side of this spectrum, it also becomes invisible. So you have X-rays and you have gamma rays and all these types of different rays that become invisible but definitely have an effect on how the body responds to it. Laser works in a couple different ways where we know that there's a couple wavelengths that give us this kind of, optimal function. So all lasers are not created equal. And the interesting component about laser therapy is that depending on the power and the penetrative force that goes on with this determines what you can actually heal or what you can't heal. So if you have handheld lasers and class 3s versus class 4s and those types of things, you start to get different effects. The laser that we have in our clinic that we have brought on board is coming from a company outside of Virginia, and it's called Lumix. Lumix is a very interesting component because it has 4 major different wavelengths. It has a wavelength sitting at 640, has a wavelength sitting at 810, another one sitting at 910, and then finally one sitting at 1064. Means nothing to a lot of people, but what it does is all these have different effects and different components on tissue healing. When we look at the 640 wavelength, what that does is that allows you to start to move into more superficial stuff, skin. It's very much influenced by hemoglobin and water, and so when that becomes an effect, the penetrative sources of the 640 is not that great. It gets really absorbed a lot into the skin. When you move into the 810, that has a little bit more deeper penetration because it's not influenced by the skin, it's not influenced by water, it's not influenced by blood flow. So this allows us to move into a deeper concentration or deeper penetration, which allows vascularity to start to form. Vascularity is the key to healing. So when we look at any type of condition, depending on how we perfuse blood at rest or even with activity really determines how typically we heal. These 2 groups that heal the slowest in our clinic is typically going to be the diabetics and the smokers because what they're doing is they're reducing oxygen. What laser does is it is able to have that capability to bring blood vessel formation, which is called angiogenesis, to the area. And when that happens, that means you get a flush of blood, which means a lot of oxygen, and oxygen is the key component to how anything starts to take that first step in healing. When you start to move into the 910 wavelength, that starts to move into what we call energy production, which is ATP synthesis, and this is going to start to create a mitochondria component where you start to bring mitochondria to the area, and mitochondria are a component of where you start to create enough energy to heal. Finally, when you get into the 1064 wavelength, that's what that's going to be, is that's going to be just for how we can penetrate and how deep we can go. So you can be superficial or you can be into a low back that has thicker tissue, and you can penetrate into tissues up to 6.5 centimeters. All of these, when you come together and start to formulate this type of treatment plan, has a major, major positive effect for patients at this point. So, some of the benefits of laser is going to be, it's a non-invasive technology and means there's no downtime. So when you do and you perform laser, it is a technique that's going to be used that doesn't cut things open, doesn't create another injury and that type of stuff, that allows the person to continue to function at a high level while they're healing. The next thing it does is what we call angiogenesis. And angiogenesis is just the formation of blood flow coming to an area, saturating the area with blood or oxygen. The more oxygen we can get to an area, the quicker you can heal. The third thing it does is mitogenesis, and laser kind of almost acts as a magnet for mitochondria. If you go back to cell phys and that type of stuff, mitochondria, if we remember, were referred to as the powerhouse of the cell. So just as your hair takes energy to grow, just as your elbow needs energy to bend, you also need energy to heal. So if we can come up with a way that you can bring a lot of these cells to a particular area and that are loaded with energy, then the amount of energy that it takes will allow us to heal in a much quicker and more efficient way. The other thing it does is it attracts amino acids, and amino acids are your building blocks for strength. In any condition, when you have a lack of motion, you typically have atrophy or muscle wasting away. And when that occurs, we need to continue to try to build that strength up. As we do that chemically, we can influence that by laser as well, by bringing amino acids, which are the building blocks for muscles and strength and proteins. Finally, what it does is it decreases scar tissue. Scar tissue is one of these things that inflammation continues to produce, and scar tissue usually becomes a chronic source of aggravation. Laser, by flushing the area with blood, decreases the chances that fibroblasts, which is a cell, can proliferate and create more stickiness or more sluggishness or more things kind of sticking together. When we move through space and time, whether we move our elbow, our wrist, our neck, What's supposed to happen is muscles that live in layers are supposed to glide on top of one another. But ultimately what injuries do and scar tissue does is it makes things cross-link. And when they cross-link, you can no longer go through a strong range of motion or a vibrant range of motion. The smaller the amplitude of range of motion means the less you're using of the joint, which means the less muscle contraction you're using, which then starts to continue to flow into a concept of atrophy and weakness. The more that we continue to spell that, the less we can actually meet the demand of our life. That might be, when you're in a computer and you're typing and you get elbow pain, or if you have back pain and that type of stuff and you're sitting, you can't sit or you can't sleep. All these things become a source of aggravation in what we call postures of rest. Laser allows us to start to move in a different direction with that as well. So what I'd like to do is we're going to show a demonstration on how laser works, the effectiveness of it, and we will start to see how non-invasive this technique is, but how powerful it is as well. So as we were explaining laser before, we want to just do a quick demonstration on how it works, and then what the patient experience could be as you would want to, as you come through, and what you would be on your expectations. So laser is a fascinating tool, like we said. It's a new technology into most clinical applications, but it's been around for over 100 years. So what we're going to do is we're going to demonstrate how we'd work on an elbow, but this application can be used for low backs, disc herniations, tendinitises. The multitude of different conditions that it can influence is significant and robust. What it does is that mitochondria have their own chromosomes, and their chromosomes produce 13 proteins. And in those 13 proteins, 7 of those 13 are all identified with healing. So we can actually take the chemical mediators that are making you feel pain in this area here of an elbow or a low back at this point, which are going to be interleukin number 6, arachidonic acid, prostaglandins, tumor necrosing factor. And what laser does is it increases the mitogenesis to an area, or mitochondria, which then kind of erases those cells. When those cells are no longer around, then what ultimately happens is it doesn't get interpreted to the brain to create an inflammatory response. This allows us to go from injury to repair to regeneration, which is what the body should be doing on its own. But sometimes it just gets stuck. Sometimes it gets sluggish. Sometimes it's just a result of how we operate our lives through the occupations that we do and some of the sports that we actually participate in. So I'm going to demonstrate laser onto the elbow. If this were a tendinitis, this is what it would look like, and this is what the expectation would be for a patient to come through. So with no further ado, we'll go from here. So what happens here is that you have to wear goggles on this for protection of the eye, because laser can have a direct impact onto the retina. So patient's safety and doctor safety is going to be where we use the special goggles at this point and glasses to help protect the eyes so there's no damage that's being done to them. So what happens here is that laser is going to look like this. It has an aperture here that can control the density and how wide the beam should be and how low the beam should be. And that's going to be under the direction of how the clinician is going to apply that as well. So here we go. What we do is we're going to set that on top here just like this. This would be a lateral epicondylitis, and what we do is we'd go ahead and start. And that beep that you're hearing is what's ultimately happening and is condensing the light into a situation where it becomes fine and focused, which is now giving us a penetrative ability. So what we're going to do here is that we go ever so slowly over the area that's injured. And what's happening right now is that underneath the skin, we're starting to modify and change some of the different chemical mediators in cells that would be causing any type of inflammation. The technique usually takes anywhere between 10 to 12 minutes. And we're going ever so slow as we start to try to create a physiological change underneath the skin to decrease inflammation, spasm, swelling, redness, heat, and improve function. So what we do is we do this for a certain amount of time, and then what we'd have is we would go ahead and do spot treatments. And so spot treatment would look like this, where we're just going to hold for about 30 seconds or till the patient says that it feels like it's starting to create heat. And once it starts to do that, then what we do is we start to move it to a different location, hold that for about 30 or 40 seconds, and have that start to build its saturation up. And as the saturation continues to build, then we just continue to move. And that technique is going to start to saturate the area in a way that allows healing to become more optimal. Our last phase with this is going to be where we have patient motion starting to be influenced here. So what we can do is we can have the patient bring her hand up here like this. I can hold steady here, and all she will do is simply go ahead and come down like that, and then come back on up. And we'll repeat that anywhere from 8 to 10 times, nice and slow. And again, if she starts to feel any heat, we just simply move. Motion creates activity, and activity creates blood flow. So now you get a dual effect of blood flow from the laser, but also blood flow from the patient moving it. Then we'd have the patient stop, and we would just bring her back just like this. And then we would repeat that for the entirety of the whole session as we start to move through. Also, what we can also have the patient do is come out here just like this, and now she can go ahead and make a strong fist. Hold that, and that is forcing a ton of blood into the area. And then she can release and open up as wide as she can go, and squeeze again, hard, and then open. All this is just trying to create blood flow. The more blood flow we get, the quicker the healing time goes. So, as you can see, it is a painless procedure. You can take that off. And in the painless procedure, this starts to create a healing process that has now been documented for many chronic injuries, up to 50% of the healing time. So something that was taking anywhere between 6 and 8 weeks or 3 and 4 months to start to heal, you can start to see that stuff reduce by 50%, which would be anywhere from 4 to 6 weeks up to whatever condition that we see length of time, how treatments have been rendered in the past. It's an exciting component to what we are doing right now when we look at New Hanover Chiropractic and how we're trying to continue to follow the direction of the evidence and keep up with the latest technology to serve our community to the best of its ability. It is an exciting time to bring this in and share this with our community. Good day and good health.